Patrick Foy, Chairman of the MTA. Dr. Howard Zucker, you know, Commissioner of the New York State Department of Health. To my left, Melissa DeRosa, Secretary to the Governor. To her left, Robert Mujica, who is the Budget Director of the State of New York and wears a second hat today because he's also a member of the MTA Board. Doesn't really wear a second hat, that was metaphorical. What day is today? When I was at Housing and Urban Development, I would sometimes say in a staff meeting, what day is today? What's the date? And I worked with a great fellow who was a Catholic priest, Father Joseph Hakala. And he would say, today is another day to do better. This warm smile. Today is another day to do better. He passed away, Father Hakala. I have his picture in my room, and I was thinking about him last night. Today's another day to do better. It's another day to improve. It's another day to be better, to make life better, to be better at helping people. Today's another day, another opportunity God gave us. Hospitalizations are down. Good news. Net change in total hospitalizations down. Good news. Net change in intubations down. Good news. New COVID cases slightly down, 933, but still unacceptable, but down from where it was. Number of lives lost, still terrible, 306. Optimists would say the number's on the decline. Realists would say that's a tremendous amount of pain and grief for hundreds and hundreds of New Yorkers who lost a loved one. Big question everyone is asking, reopening, when, how, where? I've said from day one on this situation, we have to be smart. We're at a place we've never been before. Emotions run high. Be smart, follow numbers, follow data, talk to experts. Don't get political. Even in this election year, even at this partisan time in this country where everything is political and everything is polarized, not now. And respond to facts and data and experts, not to emotion, which also runs very high right now. If we do this right, it is a science reopening. It's not a political exercise. It is a science. It can be based on numbers and data. And that is true. Everybody wants to reopen. Caveat is, reopen, but don't reopen in a way that increases the spread of the virus, doesn't increase the rate of the spread of the virus. Well, how do you know that? You can test. You can get numbers, test, get a sample and see what's happening. You know that if the rate of transmission goes over 1.1, you are in an outbreak, you're in an epidemic. So you don't have to guess. It's not what it feels like. Get the numbers, do the testing, get the numbers, rely on the numbers. The second fact you have to deal with as a science in this formula, do you have the hospital capacity available if that rate of infection increases? Don't go above 70% capacity, so you have a 30% buffer, so we don't wind up in the same mad scramble that we were in last time. Make sure you have ICU beds with the 30% capacity, and make sure you have enough equipment. We're not going to go through who has a mask, who has a gown, who knows someone in China. Let's have at least a 30-day supply of stockpiled equipment, ventilators, masks, gowns, gloves, etc. They are facts, it's science, it's data. Then what's testing? Testing, then you trace, then you isolate, and that remains the key to controlling the rate of infection. The testing is how you monitor the rate of infection. What's happening to the rate as you increase the economy, the economic activity. I will take a test, and we'll test enough people so we have enough data to make a decision. We're increasing the number of tests. It's hard. Nobody's done it on this scale before. There's been a lot of back and forth. Met with the federal government, met with the president. We have now a partnership in how to do testing. We're ramping up testing. We're moving very quickly in this state. We do more tests in this state than in any other state in the United States. We do more testing in this state than any country on the globe per capita, so we're doing it well. We're doing it aggressively. We've increased from about 20,000 tests to about 30,000 tests per day, and we're still ramping up, and that's good. More to do on testing and more to talk about on testing, but not today. Today we're going to talk about tracing, which is the second step after testing, right? You test, you now know what's happening on the infection rate. You can gauge your decisions based on that infection rate. Second step is trace those people who came up positive. All right? You tested, you have the data. You can adjust the opening valve, reopening valve. Now you trace. When you get a positive, you talk to that person and trace back who they have been in contact with. You then test those people, you then isolate those people so you don't increase the rate of infection. That's what tracing is. Faster you trace, the better. You want to test right away. You think you have symptoms, you think you were exposed, come and get a test, do it today. Once you get that test results, you have data on what's happening with the infection spread. You then right away, as quickly as you can, trace that person. Who have they met with? Who have they been in close contact with over the past 14 days? And you then contact those people and say, you may have been in contact with Dan. Dan tested positive. You should check your symptoms. If you develop any symptoms, let me know right away, and we'll bring you in to take a test. That is tracing. The problem is, it's not rocket science to do it on an individual basis. The problem is the scale that we have to do this at. Yesterday, we tested 4,681 people who were positive. Yesterday, 4,681 people were positive. How do you now communicate with 4,681 people, trace back all the people they've been in contact with over the past 14 days, close contact, and contact those people? That is an overwhelming scale to an operation that has never existed before. We do tracing now, but on a very limited basis. That's why this is so hard, tracing. In and of itself, one person, it's easy. 4,681 on one day. Today, we'll have another 4,681 people. So just think of the scale of the operation. Last week, we announced that Michael Bloomberg would lead the first ever testing, tracing, isolation program. Figure out how many people, how to train them, what technology, how do we do this? And it's of a scale never been done before, and by the way, we need it tomorrow. There is no time to go get a university to do a study and a blueprint and then put a plan together. We need it tomorrow because we're literally doing it right now. We're doing the testing. We're coming up to scale on the testing. You need the tracing to come up to scale to meet what we're doing on testing. The estimate so far is you need 30 contact tracers for every 100,000 people who are in the affected area. Statewide, that would be about 6,400 to 17,000 tracers, depending on what happens on the testing rate. The more people test positive, the more tracers. The less people test positive, the less tracers you need. So these things are all linked, right? The better you do at reducing the spread of the virus, the fewer people test positive, and the fewer people you need to trace back. But it will require, under any estimate, a tracing army to come up to scale very, very quickly. And Mayor Bloomberg has put together a great team who's going to work on this. He has great talent in his Bloomberg Philanthropy, Johns Hopkins University, working together with the New York State Department of Health. This is that undertaking, and it is massive, and that's why bringing in a person with the talent of Mayor Bloomberg and the experience of Mayor Bloomberg to do this is essential. Where do you get the Army? Well, we have Department of Health employees all across the state. Counties have them, cities have them, the state has them. We'll marshal those employees. You also have a lot of government employees who are at home now getting paid but are not working. What government employees who are now existing, city, state, county, can we deploy to become tracers and then train them, et cetera? After you go through all of that, if you don't have enough, you're going to have to hire people. And then you have to train them right away, because nobody's done this before. They're going to need help. They're going to need technology. They're going to need monitoring. They're going to have to be tested before they can do this. So it's a massive undertaking. And that's why Mayor Bloomberg's involvement and his generosity here is so important. And we want to offer a big thank you to Mayor Mike Bloomberg, who I believe may be joining us by telephone or some technological means. There he is. How are you, Mayor Mike?
I'm here.
Good to see you.
Governor, I'm fine and good. It's good to see you, and I want to thank you for all your good work to lead this great state through this crisis and to deliver facts and data to the public, and also a sense of hope, which really is important. I know your daily press conferences have become must-see TV for a lot of people. And for the record, I thought your advice to fathers on what to say about a daughter's boyfriend was exactly right the other day. Anyways, the question on everybody's mind continues to be, how can we begin to loosen these restrictions and begin reopening the economy? And one of the most important steps we have to take to reopen the economy as safely as possible is to create a system of contact tracing, as you just outlined. When social distancing is relaxed, contact tracing is our best hope for isolating the virus when it appears and keeping it isolated. The governor has recognized that, and since Bloomberg Philanthropies has deep experience and expertise in public health, we're glad to support the state in developing and implementing a contact tracing program. As Andrew said, the contact tracing is a way to identify people who may have been exposed to the virus but don't know it. And doing that requires a lot of well-trained people who are coordinated and managed effectively. It is a very big undertaking just because of the scale. So we've enlisted the best public health school in the world at Johns Hopkins University. No offense, but it's named the Bloomberg School of Public Health, which our foundation works very closely with on public health and other issues. And we've also teamed up with the nonprofit organizations Vital Strategies and Resolve to Save Lives. Now, to get the contact tracing program up and running a lot has to happen first, and hiring, training, deploying, and managing a small army of New Yorkers, as the governor said, is really the great challenge. To help the state recruit contact tracers, we've brought in a staffing organization. And we're also teamed up with CUNY and SUNY, both of which will help identify potential job applicants. And I want to thank both of them for their work in joining us. To help the state with training, Johns Hopkins has developed a training class which can be taken remotely. It will cover all the basic information of epidemics, contact tracing, and privacy. There's also a test at the end of the training, which you have to pass in order to be hired. So we're not going to put out people there that don't know what they're doing. We'll also put technology to use in other ways. Vital Strategies is developing 3 new smartphone apps. The first will help contact tracers find information and data quickly. The second will help the public provide information to health departments. And the third will allow those in quarantine to access the guidance and services they need, including the ability to report any symptoms they may be experiencing. Vital Strategies is also working directly with the state to develop protocols and workflow materials for contract tracers and managers. That includes a comprehensive playbook that will detail the steps needed to do contact tracing effectively. And I want to make it clear, we will release that playbook publicly so cities and states around the country can use it, and so can nations around the world. That way, the work we do here in New York really can help fight the virus globally. We'll also bring in a group of outside experts to conduct an evaluation of the program so that other states and countries can see what worked well and identify areas they can improve on. And we'll learn as we go and make adjustments and share what we've learned. Sharing and spreading best practices is something that Bloomberg Philanthropies works on with cities around the world. In about an hour, I'll be getting on a call with mayors around the country, which is a call we hold every week. It's been a good way to share information and strategies. And I know all of the mayors are following the news of the contract tracing program that we are starting here, and that other states have also begun the process of starting. Now, before I turn it back over to the governor, let me just echo something that he has said repeatedly and that really is important to remember. As tough as these times are, we are New Yorkers, and we've been through a lot together, and we're going to get through this together again. So, Governor, back to you, and thank you for everything you're doing. Together, we're going to lick this and get back to a normal life that we can, and we are so proud of the way the citizens of this state are behaving. Thank you all.
Thank you. Thank you very much. Thank you very much to Mayor Bloomberg. This is such a great asset for the state of New York and all the people in it. This is a monumental undertaking. You know, so many of these things that we talk about just never existed before. Testing of this magnitude, contact tracing of this magnitude, it's never existed. So we have to design new systems, new approaches to do this. And this problem is bigger than any one of us, but it is not bigger than all of us. And using the expertise and the talent that we have, we get everyone to work together here. We will do this. And the mayor is exactly right. New York, he says as a New Yorker, in many cases, we've dealt with challenges first. We figure it out, and then we work with other places to actually learn from what we've done. I think this is going to be one of those examples. We want the best system that we can have to get New York open and to protect New Yorkers, but it will also be a laboratory to put together the best system ever put together so we can share that with other governments. And that's what Mayor Bloomberg does so well. He did as mayor, and he does it now through his philanthropy. So we'll develop the best system here, and then what we learn, we hope, can benefit other people. We'll also be coordinating this contact tracing on a tri-state basis because many of the people who come into New York live in Connecticut, live in New Jersey, go back and forth. We don't want to get limited by jurisdictions when you're doing this contact tracing. Somebody turns out you have a trace that takes you to a person in New Jersey. Well, we work in New York. We can't go to New Jersey. Having that tri-state alliance makes tremendous sense. So I'm working with Governor Murphy and Governor Lamont on that, and I want to thank them very much. Next problem, stone to stone across the morass, right? Problem to problem across the morass. In this situation, every day there's a new problem that pops up. Okay, let's handle it. Next problem. In an emergency crisis situation, what happens is problems compound, right? You're in the middle of a hurricane. The power lines go down. Now the power lines go down. Now the heat is off. Heat is off. Now people are freezing in their homes. We didn't anticipate that. I know, but that's what happens. One problem creates another problem. It's like a bad game of dominoes. And these problems compound each other. And the combination is often unforeseen. We have that now with the New York City subway system. Daily News did a front page story which crystallized it, but it had been happening for weeks, and no one anticipated it. But you have a virus outbreak, and this conditions on the New York City subway system, for a variety of reasons, have rapidly deteriorated. When you think about what happened, you can put it together in the retrospective. The COVID outbreak happens. New York City is a place of density. Subways, buses are a place of density. MTA employees who run that system, care for that system, get sick, call in sick, as they should. They don't want to infect other people. The number of MTA employees comes down. Number of NYPD, New York Police Department, they get sick, their numbers come down. You now have fewer MTA workers, you have fewer NYPD workers on the trains and in the stations. We have now a greater need than ever to disinfect the subways, the buses, and the stations. Why? Because you're in the middle of a pandemic. This is a place of density, and you have thousands and thousands of people going through these subway stations, these turnstiles, and these buses, trains, and ADA vehicles. Because MTA workers are sick, NYPD officers are sick, you have fewer people to monitor and maintain the system. And this all happens in the midst of a public health emergency. At the same time, you have more homeless people who now are on fewer trains, and you have fewer people to outreach to the homeless people. So now you put all of this together. And then, at the same time, we need our essential workers to go to work. I said the other day, I had two great nightmares from day one. Nightmare one, you did everything you did, closed down, etc., and you didn't stop the rate of increase of the virus. That would have been a nightmare. Can you imagine if we did all of this and we still saw that virus going up? That would have been a real problem. Second nightmare, the essential workers say, I'm not going to work. I'm not going. The transit operators, the police, the food delivery people say, it's too dangerous. I'm not going. I'm staying home too. You don't have food, you don't have power, you don't have transportation, you don't have electric. Now you see society in a really difficult situation. So we need those essential workers to go to work. I am pushing every day to get our essential workers to go to work, even though they see a lot of their colleagues getting ill. You need those nurses, you need those doctors in very difficult circumstances. That's why I say they are the heroes of today, all the essential workers. How do our essential workers get to work? They need the public transit system. It's true in New York City, it's true all across the state. They need the buses, they need the trains, they need the subways to get to work. We need them, they need the buses, and they need the subways. And we are, as a society, me as a spokesperson for the state, I'm saying to them every day, I need you to do this. I know it's hard, but I need you to do it. Okay, we need them to do it, but what is our obligation? Our obligation is to make sure we're doing everything we can do to keep them safe, right? That's my personal obligation, and it's the collective obligation. You want them to be there to deliver the food. What's your obligation is to do everything you can do to make sure that they are safe while they're doing it. The MTA understood where we were with this global pandemic. They stepped up operations and were cleaning trains and buses every 72 hours, which is an amazing undertaking when you think about it, to clean all those buses and trains every 72 hours. But we know the virus can live for hours or even days on a surface, which means if somebody positive walks onto a train this morning, that virus can be there tomorrow and the next day. That then changes the whole focus of the problem. You want to honor the essential workers. Thank you, thank you, thank you. We'll fly airplanes. We'll have public demonstrations of gratitude. Yeah. Even better than that is what you do and how you act. And let's make sure that we're doing everything we can. Let's clean, disinfect those trucks, those buses and trains every 24 hours. Why? Because that's the way we best protect the health of our essential workers, which makes sense if you want the essential workers to continue to come to work. It makes sense if you don't want the infection rate to go up in your society. It makes sense if you don't want the essential workers to get sick. And again, it is our obligation as human beings to reciprocate and make sure we're doing everything we can. Now, to say disinfect every train every 24 hours is just a task that nobody has ever imagined before, okay? I would wager in the history of public transportation in this nation, you never had a challenge of disinfecting every train every 24 hours. Disinfect, how do you even disinfect a train? You know, we clean trains, but how do you disinfect? This is a whole new process. These are new chemicals. This is new equipment for workers. It's new methods. Just think about it. You have to disinfect every place that a hand could touch on a subway car. Every rail, every pole, every door, wherever a hand could touch, or coughing, sneezing, wherever droplets could land, right? So you have to disinfect that entire interior of the car. And then you have to disinfect the stations, the handrails, everything that people could be touching. It is a massive undertaking that we've never done before. But that is the right thing to do. That is, as we said, we've never done tracing before. We've never done disinfecting train cars before. But so what? That's what we have to do. So figure out how to do what you have to do. And this is what we have to do. And I challenged the MTA to come up with a plan. They came up with a plan. They can disinfect all trains and buses every night. It can best be done by stopping train service from 1 a.m. to 5 a.m. every night during the pandemic so they can actually perform this service. Now, remember the context that we're in this pandemic. Ridership is down 92%. 1 to 5 are these slow hours, 1 a.m. to 5 a.m. It's the lowest ridership. Estimate is about 10,000 people ride the system overall during that period of time. So the MTA will launch what they call the Essential Connector Program. They'll have buses, dollar vans, and if necessary, will provide for-hire vehicles to transport a person, the Uber, the Lyft, the Via vehicles, at no cost to the essential worker. during those hours to provide transport. So people who need transportation during 1 a.m. and 5 a.m. can have it, will have it, even to the extent of a for-hire vehicle paid for by the MTA. Remember, 1 a.m. to 5 a.m., we don't have bars open, we don't have restaurants open, so you don't have a lot of traffic that you would normally have. You do have essential workers who are using our trains and subways, and they will have transportation during that period of time. This is going to be one of the most aggressive, creative, challenging undertakings that the MTA has done. It's going to require the MTA, the state, the city, the NYPD to all work together. It's not that easy to stop train service. You have to close down stations. You have to make sure people don't walk in. Then you have to figure out how to clean all these trains and all these stations. I've consulted with the elected officials on the MTA's recommendation, and we all agree to accept the plan on the Essential Connector program. The MTA is undertaking something that people would have said was virtually impossible. Trains and buses will be disinfected daily. Service will continue. The MTA will also disinfect the fleet on the the Metro North and the Long Island Railroad, which is what goes out to Long Island, goes to the northern suburbs. They can do that without any disruption in service because of the volume of ridership, et cetera. So just think about it. The entire public transit system in downstate New York will be disinfected every 24 hours. This is a joint MTA state-city partnership. We are doing a lot of things here that we've never done before, and I am never one to shy away from a challenge. I don't believe government has that option. I'm never one to say, well, that's just too much, too hard, too ambitious. We can do it. I believe we can do it. I believe we can do anything. I believe we can build bridges. I believe we can build airports. I believe we can defeat global pandemics. But this is as ambitious as anything that we've ever undertaken. And it's going to require a lot of extraordinary service and effort from multiple agencies all working together. The MTA has stepped up by recommending this plan. The state will do whatever it has to do. Big part of this falls to the city, and I've spoken to Mayor de Blasio. It's going to require a lot of assistance from the NYPD. It's going to require a lot of assistance from different city agencies. Again, close down every station, close down the trains. We've never been here before. And I guarantee another 10 things come up when we go to do this that are also unanticipated consequences. So the mayor is really stepping up to the plate here and is doing something that no mayor has ever attempted to do before. We'll all do our part. We'll all work together. But it's a heck of an undertaking for the mayor, and I applaud him for his ambition here in stepping up and taking this on. You know, it's always easier to just say no. It's always easier to say we can't do it, because when you say we will try to do it, now you're changing things, and whenever you change, there's opposition. Every time. So it's always easier just to stay status quo. It's always easier not to risk, to be, not to try to raise the bar, because maybe you can't do it, maybe there will be problems. So it's easier just to say no. It's easier to say this is all we can do, it's impossible. That's not what the mayor is doing here. The mayor is stepping up, and he's stepping up in a big way. And I want to applaud him for it. And I think we have the mayor who is on the telephone or some electronic means. There he is. Mayor Bill de
How you
Blasio.
doing?
Welcome to Albany.
Governor, it's a pleasure to be with you. Governor, I want to end that last point you made about all of us together, doing something different, doing something necessary, and being willing together to go someplace we've never been before. You and I have talked about this kind of idea a lot over the years. You know, I think when we first met each other, the word disruption was considered a bad thing. In recent years, it's taken on a very positive connotation that when we disrupt something that isn't working or has been thought about in a very narrow way and we go someplace new and better, that's a positive. And I think what we're talking about today is exactly that. And I commend you and everyone at the MTA. And I want to talk about why I think this plan is so important in terms of our essential workers, our first responders, our healthcare heroes, why I think it's so important in terms of also addressing homelessness in a new and powerful way. But I first want to say, I want to express my appreciation along with you, really appreciate back on one of your previous topics, the contact tracing, really appreciate that my predecessor, Michael Bloomberg, is stepping up in such a big way for New York City and New York State. And the contact tracing, the test and trace approach is going to change everything. You and I are united in that as well, the aggressive approach. In fact, Governor, New York City right now is hiring 1,000 contact tracers with healthcare background to supercharge this effort. And I think we are going to be able to show this country a model that's going to be extraordinarily effective in beating back this disease. So I look forward to that partnership as well. But right here on the issue of the MTA, we've all been thrown the biggest curveball in our lives with this pandemic. But look at the consistent heroism of the healthcare workers, the first responders, the grocery store workers, the pharmacists, everyone who came forward. And Governor, I know you feel it too. It's probably the proudest moment we've had as public servants in this state, in this city, watching the heroism of these New Yorkers who have stepped up. Now, we owe it to them to understand their lives. And the notion that they have a daily routine where they go into battle, they go toward the danger, they go where the infection is, which so many people couldn't even imagine, but that's what these heroes are doing. We owe it to them to support them every way possible. You and I have talked many times about the PPEs and the basic protections, but we also owe it to them to be safe on the way to work, on the way back home to their families. So I think what we're doing here in partnership is exactly the right thing to say. We're going to find a way to make our subway system cleaner than it's probably ever been in its history, honestly, and address this crisis in a whole new way. I agree with that, and I commend you for it. And yeah, it took some disruption to say we're going to do something during this pandemic we've never done before, but it makes sense when it comes to protecting our heroes. The second point, homelessness. Look, another issue you and I governed on decades. Well, we know it's been in many ways an intractable issue because there wasn't always an impulse to disrupt. And here is an example of saying, look, we now have found new ways to get street homeless people off the street. And I want to commend Commissioner Dermot Shea and everyone at the NYPD who's really focused on how to help the homeless, Commissioner Steve Banks, everyone at Homeless Services and Social Services, and all those, also those heroic outreach workers. Governor, you know about this work, who go out there day after day to engage homeless people on the streets and the subway, get their trust and get them to come in to shelter and ultimately to permanent housing. This work has always been in some ways stymied by the reality of a homeless person who is struggling with everything they're dealing with, a mental health challenge, a substance abuse challenge, riding the subway all night long. We're New Yorkers. We know about this reality. And it's been put in a stark light by this crisis, like so many other challenges and disparities have. Well, it's an unacceptable reality. And this new plan will disrupt that unacceptable reality and allow us to actually get help to people more effectively. Because if you're not going back and forth all night on a train, then you actually are coming above ground where outreach workers are there to help you, where NYPD officers trained in homeless outreach are there to support homeless people and get them to a better situation. Governor, for decades in this city, somehow homeless encampments were actually tolerated. People thought, oh, it's the kind of thing, what can we do about that? I'm proud to say in the last few years, homeless services, NYPD, nonprofit organizations, we got together and we said, we're not allowing that anymore. We shut them down, and we found it actually helped us to get the homeless to the help they need. This is another example of that. So I want to let you know that as we all talked about this idea, and I commend you, your team in Albany, and obviously the team at the MTA, Pat Foy, Sarah Feinberg, it's been a very productive conversation these last few days. And what I think we've come to together is that, yeah, we're going to do something unprecedented. We're going to do something because of an emergency, but we're also going to do something that's going to protect people and offer a new way to get people help who never got enough. And so, Governor, thank you. I think this is a partnership. You're right. It's not going to be easy. No one said it was going to be easy. But you have my full commitment, the commitment of the city, the commitment of the NYPD, and all of our agencies. We're going to make this work together. And we're going to be able to look back and say, we did something that actually changed people's lives for the better. And as long as it takes, we're going to stand with you and get this done.
Thank you. Thank you very much. Thank you very much, Mayor de Blasio. Mayor made a lot of good points. You're right, Bill. Nobody ever said it was going to be easy, but nobody ever said it was going to be a system, because the truth is it wasn't working well, or as well as it should before. We did have a problem with the homeless. And Bill is right, Mayor de Blasio is right. I've worked on it all my life. Outreaching to homeless people is very, very hard. And getting them to come in to a place that actually provides services is very, very hard. So this can actually energize the connections with outreach workers in the homeless population. And we've never had to disinfect trains like this or buses like this, and they will be cleaner than ever before. So, global pandemic, but you live, you learn, you move on, and most importantly, you meet the challenge. You meet the challenge. And this is a daunting challenge. And the mayor is stepping into it with eyes wide open, and it takes guts. And it takes courage. And there'll be bumps along the way, I guarantee you. But that's where we are, and that's why we get the big bucks. But I also want to be able to say today to the essential workers, we thank you, not just with words, but with our actions. And I want you to know we're doing everything we can to keep you and your family safe. And that's what it means to say thank you. Act with gratitude. Don't just use the words, act with gratitude. They're on those trains. They deserve to be kept safe. They deserve to have a clean, safe ride to and from work. And they're going to have it. And we're going to move heaven and earth to make sure that happens. So, in a challenge, what do? We come together. And we rise to the occasion. Never did it before, I know. So we'll do it now, and we'll figure out how to do it. And we've overcome every obstacle that we've been thrown. We have the beast on the retreat. We're making ground every day. We just have to keep it up, and we will, because we are New York tough. We are smart, we are disciplined, we are unified, and we are loving. Questions?
Governor, in terms of the subway shutdown, will that be pegged to the on-pause order, or what are the exact parameters for that?
No,
for
it has
that
nothing to
shutdown?
do with the on-pause order. It goes into effect. When is the effective date?
Morning hours of Wednesday, May 6th.
Governor. Thank you. Yes.
And on the on-pause order, when do we expect a decision on that vis-a-vis schools and other
Before,
factors?
I said by the end of the week. When you asked earlier this week, I said by the end of the week.
Likely
Nothing changed.
Likely tomorrow, we would anticipate?
That's the end of the
that?
week, unless you have a different calendar at the New York Times.
I do not.
Okay.
Questions. The first is, what's your response to criticism that Seattle was quick to respond to the coronavirus while you and Mayor de Blasio were not as quick? What's your response to that criticism?
It's factually wrong. No state moved faster at the time from the first case to total shutdown. If you count days, no state moved faster from the first case to total close down. It's March 1st to March 19th. And no state at that time moved faster. So, period.
And if
You
I
wanna
could
make
also make another point on that. The emphasis at the beginning of this was on the West Coast. They did the China travel ban. They stopped the international flights that were coming into the West Coast. What they didn't do was shut down the international flights coming to the East Coast. Where do the flights from Europe come? New York and Newark. Where are you seeing the problems with the cases? New York City, northern New Jersey. We now know, based on reporting from the New York Times in the last several days, there were at least 10,600 cases in New York City before we even knew of our first positive case. So while the federal government focused on the West Coast and closed down travel that was coming into the West Coast, and they had their first cases in January, and California did their shutdown on March 19th, they didn't close down travel to Europe until I think it was March 16th. We now know there were at least 10,600 cases in New York. I'm betting that number is higher. By the time we got our first positive case confirmation on March 1st, and as the governor said, we shut down fully by March 20th. And between March 1st and March 20th, we shut down schools, colleges, casinos, movie theaters, bars and restaurants. We did it on a tri-state basis and with literally zero guidance from the federal government.
Yeah, also, just, look, I'm not big in pointing fingers or doing Monday morning quarterbacking, especially when you're in the middle of the game. But the Times, you go back and look, they didn't write an editorial saying we should close down until after I closed down, right? The sources they quote saying, well, maybe we should have closed down earlier, after that said, there's no evidence that says close down of schools, for example, makes a difference. So, if you don't have to be consistent, then it's easy to raise a point.
Okay, you would have done the shutdown a week or two earlier. How much of a difference do you think that would have made?
Look, depending on who you talk to, people would say, well, you'd get a range, but people would say you had cases coming here from Europe, which nobody knew. We had something like 2 million people coming from Europe because the virus went from China to Europe and then came here from Europe. Nobody saw that happening. Otherwise, you would have done a Europe travel ban when you did a China travel ban. Just nobody saw that coming. And if you rewind the tape, then I would go back to November, December, when you knew there was a virus, and who were the international watchdogs, and who were the international public health operations. Where's the CDC and the NIH and all those guys back in November, December, January? Where was the New York Times editorial board? Everybody missed it. Governors don't do global pandemics. That's not in my job description.
Governor, could you please comment on whether or not you would sign an extension to the look-back window as outlined in the CBA if the legislature passes such a bill? Would I sign a bill? Depends on what the bill says, and I would need to see the bill and then make a decision. There's some confusion about whether or not.
Tomorrow, rent is due tomorrow. People are, still not receiving their unemployment benefits. We're going over this every single day. We keep hearing the same thing every day, but these people, they're doing their part. They're staying home. What kind of rental assistance can the state provide, and what sort of steps can the Department of Labor do to kind of help these people and move this process along faster?
Yeah, we're doing everything we can to move the unemployment checks faster. Every state is dealing with this. If you look at our state's processing of checks, it's actually way ahead of what other states are doing, most other states. Also, we're still dealing with the last legislation that was just passed by the federal government that had a new program that had to be implemented. But on housing, no one can be evicted for non-payment of rent, period. End of story. You cannot be evicted for non-payment of rent. We did that by an executive order. That executive order has weeks left to run. So I'm not saying people shouldn't pay the rent. You should pay the rent if you can pay the rent. But if you can't pay the rent, you're not going to be evicted. When we get to the end of that period, then we'll have to figure out what to do, because you don't want to have a situation where nobody pays rent and then landlords start walking away from buildings either, right? That would make a bad situation worse.
Now, I know the state is broke, but states like Montana, for example, they provided their, now completely different sort of scenario, but they did provide some of their residents with rental assistance. Is that something the state can do?
Yeah, if I were the state of Montana, I would do that too. But we're not. We have a $13 billion deficit.
Governor, do you have preliminary test results back from fire department, police department, transit workers that were done? And also a question for Dr. Zucker. Some doctors are concerned about toxic shock in children. Is there a connection between coronavirus and that?
Toxic shock. You refer that to Dr. Zucker.
Sure. So what the virus seems to affect different parts of the body. We know it affects the lungs. We also know it affects the lining of the blood vessels. What we have been seeing is that there are some children who may have an inflammation of those blood vessels, and they're developing a toxic shock-like syndrome. I've spoken to the medical directors of our major medical centers. There are a handful of kids that they've noticed. It's rare. It's been reported overseas. I've spoken to the experts across the country about this as well.
Governor, in terms of the contact tracing, if someone who is tested positive for coronavirus took the subway a few days before or went to the supermarket, how do you alert, and can you alert all the people that were in either of those?
You do the best you can. They call you up. Now remember, it's not, you can theoretically be infected if the person didn't have a mask, if you inhale droplets, etc. But what they do is they interview you, they come up with the people you believe you were in close contact with, family members, etc., people you went to dinner with, etc., and then they go down that list. And that's why this task becomes so big so fast, right? 4,600 people yesterday test positive. You're one of those people. I call you up. Just let's go over the past 2 weeks of your life. Pull out your journal and your phone and your calendar. Who did you see? Who were you at dinner with? Who did you embrace? Do you have a significant other? And you then would come up with a list of 20 people. And then you have to call all those 20 people and say, by the way, you may have been infected, and let me know if there's any symptoms. Call me back. Here's my text. Go to this website. Go to this app. I mean, it's a massive, exponential explosion of numbers of people. And you do the best you can, because every positive you find, you then go to isolate. What does isolate mean? And that's also another tree. Isolate means you have to be isolated so you don't infect anyone else. Where do you live? Well, I live in a house and I have 4 other roommates. And I'm afraid I'm going to infect my roommates. That's a problem. We'll find a hotel that you can stay at where you'll be isolated so you don't infect your roommates, right? Or you can stay at home, my brother's case, lock him in the basement and throw away the key. But you then have to have a house where you can be isolated that way. So you then need isolation facilities for those people who need an isolation facility. So you have to identify hotels, etc., with a number of rooms for those isolation people. That's why none of the steps is hard. It's the volume and the scale of all of these steps taken together, getting the testing up to 40,000 tests per day. 40,000 tests per day generate 5,000 positives. Each one of those positives has to go through tracing. Every one of those positives that needs isolation has to be placed in an isolated room. I mean, it just explodes.
For instance, like, it's everyone in this room, but I also went to Target yesterday and came into contact with whoever was at Target at that time. Like, how do you?
If you can't, they have some really high-tech apps where they trace your cell phone to see what other cell phone hits were near yours. That raises a lot of questions also. But if it was just, I don't know that we've gotten to this level of detail, but my instinct is if it's just you were in Target and you don't know any names of who you came in contact with, I don't know what you would do with that.
You mentioned that New York does have COVID-positive only overflow facilities, and that would be a good option for nursing homes. Can you tell us where they are, and are there any in the Hudson Valley specifically?
We have some upstate. I can get you the exact names and numbers of those places.
Governor, childcare continues to be a concern for essential workers and, of course, will be for workers who come back during phase one. This is an issue all across the state, in New York and upstate. Parents are asking us about summer camps, and I know Republican Congresswoman Elise Stefanik and some other local leaders in the Capital Region have drafted a letter to your office asking for clarity because I guess some of these camps open at the end of May, and these are vital for some parents who will be working. Have you made any decisions on summer camps?
Yeah, I'll do that in a second. What you can say to Representative Elise Stefanik and all our great Washington representatives, we could provide rental assistance for people who can't pay rent. We could provide child care for essential workers. We are now. You know what it takes? Money, funding, money. They passed the bill. You know how much it gave New York State to do any of the things we're talking about? Zero. Zilch. Nada. So when one of them says, I have a great idea, why don't we do this for every person? I would suggest maybe you say to them, oh, are you providing any funding to do that? Because the state has a $13 billion deficit. They have provided us nothing. Nothing for police, nothing for firefighters, nothing for schools, nothing for teachers, nothing for rental assistance, nothing for the massive governmental operation we have to put together with all of these things. Nothing. So yeah, you can do a lot of good things, but you need funding. Do you know about summer camps?
So as we phase in and decide on reopening in certain parts of the state, one thing we're looking at is looking at whether or not we're going to have daycare, what kinds of childcare be provided, and whether camps will be able to open for the purpose of providing childcare to the extent that we're putting people back to work in a limited basis. But those are part of those discussions right now.
Let's do another two. Who hasn't asked a question? Another two.
Sorry. Governor, there's...
All right, 1, 2.
Okay, so there were reports yesterday in a Brooklyn funeral home that there were stacked bodies, they were leaking, they were kept in unsanitary conditions. Wondering what the state health department is doing to investigate that. Were there complaints prior to yesterday, and will any penalties be issued for this home?
We are investigating that funeral home. There were no complaints about that funeral home to the Department of Health in the past, and we have issued guidance out to all the funeral homes that we will not tolerate any of that kind of behavior.
What kind of penalties will be faced? And also, why were these bodies kept in unrefrigerated trucks?
That's part of the investigation, and there's always fines and suspensions, and we will enforce this as much as possible.
Do you know where these bodies will be taken?
Looking into that.
Obviously, the funeral home shouldn't have done that, right?
What do you
Yesterday, my boss spoke to the CEO of Albany Med about reopening for elective surgeries. Dr. Dennis McKenna says that they can and should, in this area, reopen because it's serving the community. Just because it's elective, that doesn't mean it's unnecessary. And he says they also operate at about 95% capacity, so 70% is not sustainable. Is that something you're willing to review for the Capital Region?
We have reviewed it. We do review it for every region. Again, it's just the numbers. You look at the state, we have different numbers across the state. I know the hospitals want to get back to elective surgery. Many of them are under real financial pressure, and elective surgery is one of the places where they make money, frankly. In those parts of the state where we know we have hospital capacity, then we've opened them up to elective surgery. We do have a buffer on the capacity, because if you go up to 95% capacity in a hospital and you have a COVID outbreak, then what happens? Then you're right back to where we started, which is scrambling all across the state to try to find the bed, to try to find PPE. So we have a built-in buffer. You can go up to 70%, but you have to leave 30% for a buffer in case that COVID number spikes. And remember, how do you track the COVID number? We're doing testing more than ever before, but this is an imprecise science. We're doing antibody testing, but the antibody testing actually operates on a 2-week lag. The antibody testing is telling you who got infected 2 weeks ago, right? And now has the antibodies. To have the antibodies, you had to recover from the virus. So like my brother now has the antibodies. Yeah, but it was 2 weeks. So let's not make the same mistake, or let's learn the lesson of what we went through. You need a buffer on the hospital system, and that's why we say 70 to 30. Different regions in the state are not out of the woods yet. And it's don't get cocky, right? That's a lesson in life. Don't get cocky, don't get arrogant. You still see a high number in many places, and where the number is higher, we don't want to relax the elective surgery because we may need those beds for people who are gasping for air, literally.
The argument he's making is that if you neglect these other needs that they have, you could be delaying or further exacerbating other medical issues that are not being addressed because there's no hospital in this area except for in Saratoga County who is doing elective procedures.
Yeah. Well, worst case scenario, you go to Saratoga County if you really have to go now. But we don't want to be in a situation where we have a COVID outbreak and we have no hospital beds. That would be the worst. Thank you, guys.